You know, the human heart beats over 100,000 times a day, and every single one of those beats tells a story. But what happens when that story turns into a mystery? Well, today we're putting on our detective hats. We're going to learn how to listen to the heart's hidden language and follow the clues to crack the case of a faulty aortic valve.
So here's our game plan. First, we'll listen to a healthy heart's rhythm. Then, we'll see what happens when things go wrong with a valve. After that, we'll decode the doctor's clues, see how the heart tries to fight back, confirm our diagnosis with some hard numbers, and finally look at how we fix the whole thing.
All right, every good detective story starts by understanding what's normal, right? Before we can spot the problem, we need to know what right is supposed to sound like. And for the heart, that means a steady, predictable rhythm. That classic lub-dub sound everyone knows, well, it's actually two totally separate events. S1, that's the lub, is the sound of one set of valves closing. And S2, the dub, is the sound of the aortic and pulmonary valves shutting a moment later. This simple two-part beat is our baseline. Any other sound, a click, a murmur, a rumble, that's a deviation, a clue that something's not quite right. Okay, so our investigation is going to zoom in on one specific valve, the aortic valve. Think of it as the main gate, letting all that oxygen-rich blood leave the heart and get to the rest of the body. It's a critical job, and when it fails, it usually happens in one of two main ways. So here are our two main culprits. On one hand, you've got aortic stenosis, or AS. The best way to think of this is like a rusty door hinge. The valve is stiff and it just won't open all the way, so the heart struggles to push blood out. Then, on the other hand, there's aortic regurgitation, or AR. This is more like a leaky faucet. The valve doesn't seal shut, so after every beat, blood leaks backwards into the heart. See? Two very different problems, and they leave behind two very different sets of clues. And this is where the real detective work kicks in. Way before any high-tech scans, a good doctor can get a ton of evidence with just their hands and a stethoscope. The body itself leaves this trail of clues in the pulse and in the sounds the heart makes.
And check this out. These two conditions leave completely different fingerprints. With aortic stenosis, that blockage creates a weak, slow-to-rise pulse and a really harsh murmur. It's the sound of a struggle. But with aortic regurgitation, the backflow creates this weird, bounding, then collapsing pulse and a soft, blowing murmur. Literally, the sound of a leak. Each clue points to a completely different mechanical failure.
Let's listen a little closer to that murmur in aortic stenosis. The description here is perfect. Harsh ejection systolic. That's the sound of blood being violently squeezed through that tiny, stiff, rusty-hinged opening. It's a sound of pure effort. Now contrast that with aortic regurgitation. It's a totally different story. This isn't a sound of force, it's the sound of failure. High-pitched, soft blowing, that's the gentle whoosh of blood falling back through the valve that just can't close all the way. It's the sound of that leaky faucet. Drip, drip, drip. Even the pulse in your wrist tells the story. In stenosis, when you feel the pulse, it's weak and it feels delayed. That's a direct result of the traffic jam at the valve. But in regurgitation, whoa, it's the opposite. You feel this powerful, bounding pulse that then just vanishes. They call it a collapsing pulse, and it's the telltale sign of blood rushing forward, then immediately falling right back. Now, when faced with these huge mechanical problems, the heart doesn't just sit there and take it. No way. It's a fighter. It adapts. The heart muscle physically changes. It remodels itself to try and cope with the stress. But, and this is the cool part, it remodels in totally different ways for each condition. What's so incredible here is how logical the heart is. For stenosis, the problem is pressure, right? So the heart wall bulks up, it gets thicker like a weightlifter building muscle to generate more force. That's concentric hypertrophy. But for regurgitation, the problem isn't pressure, it's volume. The heart has to deal with the normal amount of blood, plus all the blood that just leaked back in. So the chamber itself stretches and gets bigger to hold it all. That's called eccentric hypertrophy. So, the physical clues have pointed us in the right direction. Our detective work is paying off. But to be 100% sure, and to figure out how bad the problem really is, we need the hard data. This is where an echocardiogram comes in, giving us the numbers that provide that real aha moment. For severe aortic stenosis, doctors use this beautifully simple little memory tool, the 40-4-1 rule. It's just a clean, number-based way to say, yep, this is a serious problem. And it's all based on 3 key measurements from that echo. First up,
Pressure. A healthy valve has almost no pressure difference from one side to the other. But here, the heart has to generate an extra 40 millimeters of mercury of pressure just to force that rusty door open. That's a huge, constant strain on the heart muscle. Second, speed. You know how when you put your thumb over the end of a garden hose, the water jets out way faster? It's the exact same principle. The blood has to accelerate to over 4 meters per second just to squeeze through that tiny opening. It's like a fire hose in there. And finally, we have the physical size of the opening itself. Get this. A normal aortic valve has an area of about 3 to 4 square centimeters. In severe stenosis, it's shrunk down to less than 1. That's the cold, hard proof. The rusty hinge is almost completely seized shut. Aortic regurgitation has its own rule of thumb, of course, the 55-50 rule. Now, this one is all about the damage the leak is causing over time. Is the heart's main chamber stretching out too wide, over 50 millimeters? Or is its pumping power, the ejection fraction, getting weak and falling below 55%? If either of those happens, it's a huge red flag that the heart muscle is starting to fail. So, we followed the clues, we've identified the culprit, we've confirmed just how serious it is. The last step in any good detective story is, of course, the resolution. We've got to fix the problem. And the solution here is pretty definitive. That faulty valve has got to go. The gold standard is aortic valve replacement, or AVR. That's open heart surgery. But for patients who are too frail for that, there's this really clever, less invasive option called TAVI, where they can actually guide a new valve into place through a blood vessel. Pretty amazing stuff. Either way, the goal is the same: restore normal blood flow and close the case. So as you can see, from a simple lub-dub, this whole complex story of pressure and flow and the heart's amazing ability to adapt just unfolds. The heart is constantly talking to us through these pulses and murmurs. And it really makes you wonder, right, as our tools get better and we learn to listen more closely, what other incredible secrets hidden inside our bodies are we just now beginning to understand?